building a better Bay Area for a safe and secure future. This is ABC 7 News.
Hi there, I'm Kristen Z. Welcome to our daily program called Getting Answers. Today, we'll talk to a spokesperson from UC Berkeley after a surge in cases is being blamed on frat parties. Does that endanger the school's reopening plan? But first, San Francisco Mayor London Breed is joining me today for her first on-camera interview since being exposed to and testing negative for COVID-19. The mayor says she attended an event where somebody knew they had tested positive for COVID-19 but still showed up. We will talk to her in just a moment, but first, let's take a look at the alarming COVID numbers in San Francisco. You can see a steady climb until late June, when the numbers started climbing more dramatically. They reflect what we're seeing across the Bay Area. The trend is going in the wrong direction, and as such, Mayor Breed just announced a new reopening plan. We'll get into that in just a bit, but first, let's just say zoo-goers may be excited, but not if you're eager for a haircut. Let's begin with welcoming Mayor Breed and listening to her personal brush with coronavirus exposure and the lessons she learned from it. Good afternoon, Mayor.
Hello.
Hello. Really, really glad you tested negative on behalf of all my colleagues here at ABC 7 News. How are you feeling today?
I feel fine. I'm glad I tested negative too, but we also have to do a test later for those who were out in the area when this occurred, because it does take some time for the symptoms or to be realized. And so that was the first. We're over the first hurdle, and next week I'll be tested again, and hopefully that'll come back negative too. But just really frustrating to experience this.
Sure. Okay, but for now you can smell your morning coffee, okay? Just want to make sure.
Yeah.
Okay,
yes,
good.
I can smell and I can feel, and I'm excited and I'm happy and I'm in good shape.
Okay, good. Okay, so walk us through the timeline though, right? When do you believe you were exposed to somebody with COVID?
So on Tuesday, for sure, this past Tuesday, I was notified on Wednesday, and I got tested right away and got the results back the next day that they were negative. And in the meantime, was told to just really limit my activities around other people, and then to also get tested next week. And then we also reached out to others who were in the area through our contact tracing efforts to make sure that others were tested. So we immediately went into action as soon as we were made aware for everyone who was in the area.
So which event was that?
I can't, for privacy reasons, from my understanding from the Department of Public Health, I can't specify. So that's why I haven't been able to.
Got it. And I know you have many public events or had, but how many people would you say were there? Were there other city officials there?
I would say there were other city officials there, and there were probably close to 70 people there. And I will say that I went to 2 events that day. So you could probably figure it out from there.
Okay, so how did you feel when you learned the person came to the event knowing they were infected?
I was livid. I was livid that someone would put not only my health, but other people who have been really struggling, that they would put other people's health in jeopardy. It was really, I was so angry. And I just thought, how could someone be that irresponsible? It's one thing not to know. We all are experiencing that, where none of us deliberately wants to put someone else in harm's way. But the fact is, you know, in this particular case, it was deliberate. And it's really sad that someone is that selfish that they would do something like this.
And it wasn't just you. There were a lot of other people exposed. Tell me about the testing, right? After you found out, you went, where did you get your test? What kind of test was it?
Yeah, well, usually, because I've been tested regularly, and so I would usually just reach out to my doctor, and I would just drive through. There's like a whole drive-through situation where they just come up to the car and do that. But in this particular case, there were a lot of us, including me and my staff, my detail, and others. And so they came to my office and they were able to test us as well as some other people.
Got it. So it wasn't one of the public San Francisco testing sites that you can find through sf.gov, right? It wasn't. They came to you.
Yes,
okay.
They came to me.
Okay. So how long before you got your results back? I know it was quick.
Yeah, I got it back the next day. And I know that there have been, my other test results in the past were not always the next day. So This was probably the fastest I've ever gotten my results back, but I've
Right.
gotten other tests in the past.
Okay, but even though it was pretty quick, within 24 hours, what was it like, the waiting? What went through your mind?
Well, I think it was just more really being angry that someone would expose me and other people to this virus knowingly. So that was really where my focus was. And then, of course, I was praying that that didn't come back positive. But more importantly, I'm still not out of the woods completely. And I'm glad that, this is coming to light because it's also a learning opportunity. I wanted to make sure that people, that the public understood what's at stake when people make irresponsible decisions, that I could have been impacted. And I have the responsibility of running this entire city. People are counting on me to save lives. And the fact that my health was put in jeopardy is really unfortunate, along with so many other people. So that's the thing that's running through my mind, where I feel strongly like I don't want to get sick, plus I can't get sick because I have a major responsibility. And so that's been what's running through my head. I'm hopeful. I feel fine. If anything changes, I will make that clear to the public. But for now, it seems like I'm okay.
Okay. And you mentioned that you will test again, and it could take a while because for the viral load to really build up to be detected. So, all right. In the meantime, have you changed your routine? Are you self-isolating? Will you not do events for a while?
Yeah. Well, I won't go out. I've decided, because I was trying to go out to restaurants and retail places and to support businesses in San Francisco. So I have been spending more time before this out in the community at various locations. And so I just decided in an abundance of caution not to do that. So I pretty much had to change my routine. I'm not at City Hall, even though I have the ability, according to the doctors, to go to City Hall. And I'm not being quarantined. I haven't been told to stay home and quarantine. But at the same time, I want to be very careful about my interactions with the public because I don't want to put anyone else at risk.
Right, for sure. I want to ask you, you addressed a little bit of the needing people to be responsible for themselves and think about who they might infect and, expose them to COVID. Do you feel like that is critical in order for us to be able to reopen schools safely, especially in your city?
Not just schools, but just think about a lot of the elderly people that live in isolation and haven't had any visitors. Think about the kids who can't go back to school. Think about the people who are struggling financially, especially people who do hair and nails and massages, and those folks who can't open their businesses and make any money. Like, we are putting so many people's financial and emotional health in jeopardy when we act irresponsible. So it has consequences. I mean, people cannot even have funerals for the lives that have been lost because we can't have large gatherings. And so I think that there's more to it than, well, I just don't want to wear a mask, or I can do what I want to do and who cares? Well, everything that you do or don't do is directly impacting other people's health. So this is important. And I know people are uncomfortable, but let's face the facts. We are living in COVID for the next year to 18 months. So we need to make adjustments in order to protect one another, in order to provide an opportunity for us to return to the things that we need in life, but also, as we do so, to keep one another safe. So it really does include everyone making good decisions and not being irresponsible with your behavior, because you never know. You could get me sick, and then I could be visiting an elderly person or what have you, and that elderly person is sick and dies.
All right,
or
Mayor,
someone with an underlying condition.
Mayor Breed, we'll take a short break on the air, but when we come back, we'll continue to talk about which activities you've been putting on hold and which ones you've just announced in the past hour that will reopen next week. And we also want to talk about access to testing. But the conversation continues right now on our live streams, including Facebook Live, where we'll talk about schools. All right, Mayor Breed. Hey guys, listen, I'm listening to Alex Trebek now. Can you switch me back to the mayor? Okay, so, as soon as I see Mayor Breed back. Oh, good. I had Alex Trebek in my ear briefly, so that was kind of a trip.
I was like, oh my God, Alex!
I know. We all love Alex. Hey, so I want to talk a little bit about schools. I know that is run by San Francisco Unified and that, you are not sitting there at the table deciding in what manner schools will open, but I do know that a decision is coming July 28th. And if distance learning is going to be the way it goes due to the trends now, what could you as a city do to support parents, for example, who have childcare needs?
Well, I am hopeful that working not just with the school district, but we have early childhood education. We have our rec and park department. We have other programs that serve young people. So I am hoping that collaboratively we can work together to provide the level of support necessary just in case, for example, say all the schools open and then we have a situation at one of the schools and it has to shut down. But we need places for kids to go, especially maybe if they're parents or healthcare workers or what have you.
Yeah.
I do think we're going to have to work together to prepare so that we can respond to any situation, because as I said to you earlier, we're living in COVID. So because we're living in COVID, we need to be able to respond quickly to the challenges that we face. And that's what we're hoping to be able to do to help the school district in that regard.
Got a quick question also for you with regard to San Francisco County jails. Those numbers are going up, positive cases. What are you doing to address that?
Well, just to be clear, San Quentin is under the state's jurisdiction. And here in San Francisco, what we've seen, immediately we reduced the population down by 30%. And then as people come into jail, if they're arrested, they're tested and they're put into isolation. So the few people that had the virus never even made it into the general population.
Okay, that's good to hear. Mayor, I'm going to put you on hold because we're coming back on TV in 5 seconds. Thank you. All right. All right, and we're back with San Francisco Mayor London Breed, who just tested negative, thank goodness, for COVID after being exposed to somebody who was infected, knew it, and attended a public event anyway. But I got to tell you, Mayor, you're looking at San Francisco's numbers. They are going up, and as such, you've really put a pause on most reopenings scheduled for next week. This is the chart kind of showing the growth, especially in the last couple of weeks. But you are allowing a couple of activities to resume, and this just hot off the presses. You announced it within the past hour. Can you talk about what's going to be allowed come Monday? I want to start with the zoo because I know families are excited about that.
Well, the thing is, as you recall, we had to move in the same pace as the state, and we couldn't jump ahead of the state. We applied for a variance. We got a variance. We tried to speed things up, and we saw the numbers go up, and we had to dial it back. But zoos probably should have been allowed earlier because our zoo, as you know, it's an outdoor facility and it has the ability to move forward. But if we didn't have a variance, we wouldn't have been able to allow the zoo to open. And so we realized, yes, the numbers are going up. The indoor activities will be challenging, but I think it still provides us more of an opportunity to open outdoor things in our city. And I really want to make sure that not only the zoo has this opportunity, but families have an opportunity to go and visit the zoo, even though they're going to have new requirements.
You know, do you open that with a little bit of trepidation? Because when you were at the zoo 3 weeks ago, you said the only way that we can continue to allow these businesses to remain open and be available to San Franciscans is if we don't see a spike in numbers. But we are seeing, if not a spike, a steady growth. A little nervous?
Yeah, a little nervous, but again, the zoo is outdoors. None of their indoor facilities are going to be open. I actually visited the zoo myself, and the way that they have it set up with the way that you socially distance and how they're going to be able to limit the capacity. They're limiting the capacity. There's ticketing, there's timing, there's a number of other things. And the zoo is huge, and there's a lot of outdoor space. So I think we're in a good shape, and I think if the Department of Public Health were concerned, they wouldn't allow it to occur.
All right, here are a couple of things that you just announced in the past hour or two that are allowed to resume. Resume using reusable bags and boat and fishing expeditions. Tell us about that.
So we take our guidance, as I said, from the Department of Public Health. And what we also realize, we're living in COVID, and we also need to adapt to our new normal. And so as things become when the data happens, when people are having the discussions about these, it's really trying to give people back the opportunities that we unfortunately have taken away And so that we work with the Department of Public Health to make those kinds of decisions, and it appears that those things are available.
Okay.
We will, however, I want to be clear, revisiting hair and nail salons and those tattoo parlors and other things that we put on pause. And hopefully, as we look at the numbers, we look at the data, we may be able to make a decision as to a timing on the reopening of those things as well. So I think it's a combination. It's a fluid situation. Things change, but we want to try and give people room to move around as much as possible.
Yeah, I mean, those that you mentioned, also outdoor dining is the big one that was going to resume Monday, but no longer. And I got to ask you, in San Francisco in particular, it is hard to create more outdoor dining opportunities, just the way you are compared to the burbs, for example, where you see in Redwood City or San Mateo, right? They're closing down some streets, making them all pedestrian so they can put tables out. What do you envision doing to assist restaurants, given that the outdoor dining is the only option at this point?
Well, we have allowed many restaurants to use parking spaces and streets to set up tables. Original Joe's, they have a great setup, and it's a great example of how we can use our public space to provide an opportunity for a restaurant. We have a permitting process, but we've tried to be very, very flexible with people in order to allow for that opportunity. And I am not opposed to closing streets and making them pedestrian only, because we are looking at neighborhoods and places where it makes sense. And our goal is to try and hopefully help these businesses maintain through this virus, because we're going to be living like this for some time. So we are definitely open to all suggestions, and it's been working out well so far for some people.
All right, Mayor, I want to talk about which San Francisco neighborhoods are hardest hit, and also access to testing in those neighborhoods. So I want to show two maps for our viewers. One shows the concentration of cases. Areas in blue, especially dark blue, have the highest number of cases per capita. That is the information that you guys put out to kind of show how the zip codes are affected, and I really appreciate that. The other one on the left shows the testing sites available in San Francisco. So you can kind of see, while there's a high concentration of cases in the southeastern part of the city, Mission, Potrero Hill, Bayview, Hunters Point, Bernal Heights, there are more testing sites in the northeastern parts of the city. Does that suggest to you that access to testing still needs to be improved in the neighborhoods where people are socioeconomically disadvantaged?
Yeah, and we always are trying to do more to improve that process, because part of it is there sometimes may not be a stationary location, but we've done a number of pop-ups to go specifically to locations to try and do testing and to make it as easy as possible for people. So from the very beginning, our emergency operation team, we embedded an equity team, outreach and work and support from folks in the community who are outreaching to various neighborhoods to try and get people tested. In the Mission, I mean, think about it. San Francisco is the second densest city in the country. And in the Mission, we saw significant spikes, and we just opened a location there, working with the community at a location where people feel comfortable going. So part of it is location, making sure we have the capacity to get people out there to be stationary for the testing. And so we're still continuing to expand based on need.
All right. Mayor Breed, it's great talking with you, and it's great to see you. Glad you were negative for COVID. Get well, or be well, continue to be well. And I hope people will listen to the message about, just taking care of each other,
Yes. Thank you.
See you again soon.
All right. Take care.
That was San Francisco Mayor London Breed. When we come back on air, a spokesperson from UC Berkeley will be talking to us about the recent outbreak being blamed on frat parties. All right, we are in break. I usually hear, you're in break, but I know we are. Thank you, the voice of God. I needed that. So our next guest is a spokeswoman for UC Berkeley. Coincidentally, that's my alma mater, but there's been sadly a big outbreak of 47 cases in just 1 week. So we're going to talk about what's behind that, and it has implications for how school may reopen on campus in the fall, which is really just coming up in about 5 weeks. So we'll talk about that. Let me take a look at some of your viewer comments. Here we go. Thanks to those of you who are with us today. Mira, you say, Mayor, please find those who won't wear masks. That is a great question and a suggestion that I will certainly bring up to her next time we get the opportunity to talk to her. That is certainly something that you've seen now in some other municipalities, the city of Monterey, for one, that's probably closest to us. So I wouldn't be surprised if that does happen, if the numbers continue to trend in the wrong direction. Robert Hedrick in Washington Square, they are all too close. Outdoor restaurants, they're all too close. I'm not sure if you mean the restaurants are too close together outdoors. Perhaps you can clarify that. But yes, I mean, if you're outdoors, the idea is you're at least 6 feet apart, but ideally even farther apart than that. So there's no hard and fast number. Robert also says, can we open the San Francisco Zoo at 50% capacity? There is a capacity that they're limiting it at. She did address that. So that is a good suggestion, and they're doing it. Okay, we are coming back in 10 seconds. All right, welcome back. Disturbing news out of UC Berkeley. University Health Services saw a sudden jump in new COVID cases, 47 in just 1 week. And the university says fraternity and sorority parties are to blame. Joining us now to talk about this is UC Berkeley spokesperson Janet Gilmore. Janet, good to see you.
Thanks for having me.
By the way, I really like your virtual background. It makes me feel like I'm back on campus. Old times. Do walk us through, though, what you know about the origin of these 47 new cases.
Well, just to back up, to just kind of provide some context. So since the start of the pandemic until about a week ago, our total number of counts of positive tests going through our health center was 23. A week and a half ago, we know that there were a series of parties and social gatherings. It was about a week and a half. And then individuals started coming in for testing, and our team found out through contact tracing that a number of the individuals who were testing positive had gone to these events, and then they went to their homes, spread the events there, or went to other small gatherings. So our numbers increased from a 23 running total to 47 additional in 1 week, so that we're now at 70.
Well, why have students been able to live in frat houses all this time? Does the university have no control?
So fraternity houses, sorority houses, they are off campus. They're private residents, just like any other apartment or home in the city of Berkeley. Some students live year round in the city of Berkeley community. Some fraternities actually rent out some of their rooms to non-Berkeley students or non-Cal Greek students for the summer. And then there are students that do live in our residence hall during the summer too. They're taking summer session courses, even remotely. So there is a group of students who are in the community year round.
But isn't there any ability to say to the frats, hey, if you want us to support you, because I know the university could end a charter or kick out a university, a frat or something like that. Couldn't you say no parties, no gatherings at this time?
So just to provide some broad context. So again, these are off campus, they're private residents. These are private activities there are no campus events at all. They're all just like if you had your own event in your own home. Campus does do is it works with fraternities and other student groups who seek to be registered with us. And there's a partnership where we provide guidance on safety, leadership, risk management. And then they get some benefits too, like access to rooms for their meetings and that sort of thing. So it's sort of a pact that groups can decide to enter into or not. So some fraternities that do have that status with us and some of them don't.
Gotcha. Okay. But does this outbreak have the university kind of rethinking housing, student housing in the fall?
I don't know. I wouldn't say that. I mean, really, they're two separate things. I mean, it's fact of life that a number of our students will be living in the community and will be choosing to have activities as they see fit. But as members of the community, they do have to follow local ordinances, laws. So, you know, that is still that's an area where they do have to be responsible in that regard. Then on the campus's part, for students who live in our residence halls, yes, there are policies that they have to follow, just like other members of the campus community, and other policies we have in for events and activities on our campus community property.
So I know making it less dense and social distancing, those are goals for the university in the fall when it comes to student housing. And I know you have different types of dorms. I lived in a Unit 3 triple when I was there. Are you going to make them all singles? What's the plan?
It looks like we're moving to that point. We do know that we won't have triples. You know, we had triples and sometimes quads. We moved from that to singles and doubles, and now we're looking at just singles. So it's fluid. We're definitely taking a hard look at reducing density.
Okay. Does this outbreak jeopardize the reopening plan that the university had earlier put out, which includes, you know, a lot of online classes, but also some in-person experiences in classes?
Well, we have always said that all our plans were contingent on, you know, public health guidance. And we do know that as outbreaks have happened in various communities and cities, some counties have found themselves having to pull back on their reopening plan. So, you know, if we're having outbreaks that spreads into the community, that could put the city, county at risk, and potentially we would have to, you know, take a look at repercussions for the campus as well.
Mm-hmm. What is the current reopening plan in terms of the mix? Like which types of classes would be online? Will labs be in person, or is it the upper division classes? Do you have kind of a breakdown for us?
So the broad approach is that the large courses, large lecture courses, actually any activities that are over 26 students or more, all of those will absolutely be remote.
Okay.
For certain courses that are smaller and other course activities that are for 25 students or fewer, they possibly could be in person. So right now we have a committee that is going through requests for that exemption and reviewing what makes sense. What do we have capacity for in terms of making space for density considerations, you know, disinfecting buildings in between classes, that sort of thing. So there's a very nuanced process of considering, you know, what we can manage from a public health perspective, a space perspective, and still, you know, provide that in-person, you know, experience.
Right. Jana, we have 20 seconds, but tell us when you have to make the final decision on whether to pivot, and what's your final message for students out there who are living in whatever their living arrangement?
Well, I wish I had that answer. I think we all wish we would have that answer. You know, this entire experience, as everyone knows, has been very fluid in terms of COVID-19 and the twists and turns, and it's no different with our community. You know, we have to follow what's going on with the pandemic, the guidance, state, local guidance in our own community, as we just learned in the last week. So we have to be flexible, we have to be nimble, and that's really our marching orders.
All right, Janet, thank you so very much. Good to see you. Take care.
All right. Thank you.
We're going to take a short break on the air, but the conversation continues on our live streams, including Facebook Live right now. Oh, Janet, are you still there? Do you still have one more minute?
Sure.
Oh, excellent. Thank you. I realize I'm taking up a couple minutes extra, and I do appreciate it. So I'm wondering, you know, I guess if there's one thing you would like to tell young people, we know that young people are very much guided by both their need for social interaction and also sometimes their feeling that their health is, you know, they can take it. I don't want to say invincible, but when you're young, you sometimes think that way. What would you tell them, whether they're living in a student dorm or off-campus apartment or a frat house, you know, in terms of those hoping to come back in the fall?
Just be a reminder that they're not immune, you know, that it's not just an issue that they could spread it to loved ones or the community. They themselves could face serious health consequences. We've seen it happen with the younger population. So they really need to take seriously all the basic safety measures of, you know, wearing your mask, social distancing. If you're going to have activities, it should be with that bubble of individuals that you have an agreement with that doesn't change week to week. It's just that bubble, your household, but not parties where you're going and you're, you know, sharing food and drinks and you're not distancing.
Yeah, exactly. All right. Well, I do appreciate, oh, by the way, the fraternities that are associated with the outbreaks, what kind of sanitizing or, you know, protocol do they have to go through?
Well, again, I wouldn't have that information. Possibly the folks who are involved with the contact tracing and their evaluations with the homes and their guidance to them, they may have that, but we wouldn't have that as a university.
Got it. All right. For months, you had 23 cases, and this 1 week and a half with the parties, it's 47 more. So Let that sink in, folks. Do the math. All right. Thank you, Janet. Good to see you. Appreciate it.
Thank you. All right. Take care.
Take care.
Bye-bye.
All right. All right, folks. Let's see. Blah, blah, blah. All right. Coming back on air. Thanks for joining us for this interactive show, Getting Answers. We'll be here every weekday at 3. World News Tonight is coming up next. Bye-bye. All right, Facebook friends, thank you for watching today. Wrapped up a week of interesting content with great conversations. I'll see you next week. 87 to 91. Oh, really? Oh.